Money FM 89.3, the best of the afternoon update. The Afternoon Update with Lynlee Foo.
Welcome to Good Tech, where we spotlight innovations and ideas that are making a difference. I'm Lynlee. Doctors today spend nearly half of their working hours on paperwork instead of patients. What if AI could take that burden away? That's what Hesyra, a Singapore health tech startup born out of an NUS project, is working on. They've developed an AI medical scribe that listens to consultations and generates clinical notes, referrals, and more, giving doctors back their time for patients. Joining me live in the studio are co-founders Qihuang and Alexander Shao-Rong. Welcome, both of you.
Thank you for having us here.
We're very excited to be here, Lynlee.
Yeah, you tell me that it's your first time on radio and first time live in the studio, I suppose.
Yes.
Okay, Qihuang, maybe I'll start with you. You trained as a clinician. Was there a moment when you realized doctors were spending far too much time, perhaps on admin, that you had to do something about it?
Yes, so this project actually borns out of a school medical project. So we had a chance to interact with a lot of cancer patients, finding out about their needs. And we found out that this cancer patient has a lot of questions. They want to ask like, what kind of medication can I take? What food can I not take or can I take? And the information needs of this cancer patient are generally very high. And at the same time, they do not feel that they have enough time spent with the doctors, talking through some of these concerns, right? And in fact, in Singapore, one of the research that was published 2 to 3 years ago shows that actually patients, 50% of the cancer patients in Singapore did not manage to obtain information from their preferred source, which is often their healthcare professionals, right? And deeper dive in the problem, realized that, as you mentioned, healthcare professionals are burdened with administrative tasks. They only have a short 30 minutes for first consult with the patient and 15 minutes for follow-up consults. And during this time, they not just have to care for their patient, but at the same time have all these orderings to do, notes to take down. So it's very, very cumbersome. And in fact, Alex, his dad, is a surgeon by training. Mm-hmm. So a lot of time we also hear him complaining about how he has spent a lot of time editing, typing down notes, when this time can be actually better spent on listening to the patients, finding out and addressing their concerns, right? So I like one of the saying by actually Dr. Rachel. So she's one of the founding pioneer for integrative medicine inside UCSF. So he mentioned that listening is actually one of the oldest, but perhaps the most important, powerful tool for healing, right?
Wow. So
that's when we say, hey, why not? Can we create a system whereby we can take in all of this conversation, generate in terms of a summary for the doctors. At the same time, through this, we can sort of unlock more time and a lot more mental bandwidth for the doctors to engage in deeper conversation and also listening to their patients on the deeper level.
Yeah, I'm sure spending time, typing notes rather than talking to patients must have been very disheartening and probably quite frustrating both for doctors and patients. I'll get to you in a bit, Alex, but Qihuang Healthcare has had plenty of digital tools introduced over the years, but many don't quite stick. Why did you feel there was space for Hesyra?
Yeah, so how we see, because both of us are trained as a clinician, so how we see innovations and in healthcare landscape really boils down to two fundamental concepts.
Okay.
So one is about quality. How can we use technology to enhance the quality of service? For example, improving patient outcomes, improving the clinical outcomes, provide better patient experience. So that belongs to quality. And how can we deliver such high quality care with the lowest cost possible? So that is generally the two fundamental concepts. And we are Hesyra is born to align with this concept as well. So we see that around the globe and in Singapore, people are becoming older. More of them will have chronic diseases, cancer, high blood pressure, diabetes. They're going to see a doctor, but we have limited pool of doctors to take care of the increasing number of patients, right? So that is when we see, hey, for us, Hesyra too, how can we better help in terms of doctors free up their sort of attention span, make sure that their limited attention span is spent on something that is truly critical, which is listening and caring for the patients. And right now, with the age of AI, patients can ask a lot of questions to ChatGPT, Google. They'll bring all these questions to doctors, say, hey, is this correct? This is my concern. So we really want to free up this time for them to actually interact with the patient, addressing their concerns on a deeper level. So that's where I think we started to see, hey, can we create some digital personal assistant like Hesyra to sort of allow them to optimize this patient experience while at the same time improving the efficiency. So in this case, it's just a start, right? Taking consultations, taking the conversation they have in clinic. It's just a start, but we wanted to do something that is more down the road, which is more to improve the quality and the data-drivenness of the care. So, for example, right now, I think previously taking consultation notes is a very troublesome process, right? The technology is not there yet. But right now, with the advancement in AI, we can take in these conversations with high accuracy and then with a lower cost. We can convert them into structured, concise notes. And from there, we contain a lot of information related to patient beliefs, related to their complaints about medical condition, or the intervention that doctor plans to do for them. So we can take all this information, break it down, and create more downstream system. For example, have an intervention, automatic interventions that is evidence-based, help doctors order some tests, medications down the road so doctors don't have to click things, don't have to write letters to send to referring physicians or insurance. Yeah, so all these is part and parcel of what we hope and envision to be as well.
So the technology adapts to the clinician rather than the other way around?
Yes, correct.
Alex, let me bring you in here. I imagine building something for healthcare is a lot tougher than building, say, a consumer app. So what were the biggest hurdles?
Yeah, so Lynlee, to be very honest, the past few months we have been fraught with plenty of challenges. So at the very start of this year, we actually had two major setbacks, I would say. First, we failed to secure a six-figure grant, one that would have very much set us on our way. And shortly thereafter, we actually lost our lead engineer because he went on to pursue his personal ambitions. And while we supported him wholeheartedly, it really brought a halt to our engineering processes. And so Qihuang and myself, we set ourselves back down. And we really had to reframe our mindset. And we dug really deep into what Hesyra truly meant for us. And I think what we found down there was a shared mission and vision, one that was backed by renewed passion. And we used this fuel to get us to where we are today. So we went on and we created a new product, and we trialed it and validated it with multiple stakeholders at every rung of the game. And here we are today. And I would say that, as with any tech startup for that matter, technical challenges are aplenty. But the true main challenge for us in the health tech industry is really an interpersonal one, a human one rather. Because the adoption and integration of new technologies in current existing healthcare systems, legacy systems, and clinical workflows is one that proves to be arguably the toughest challenge yet. And this is because it's a very resource-intensive process whereby we have to satisfy many stakeholders at every level. And this is a very arduous task to do. And how we dealt with this challenge was that we really put our boots on the ground and we explored the major pain points of not just the clinician, but the patients as well. And we built our product together with them. We trialed our product, we showed them our product, and they liked it. And I think the point that we are trying to drive across to everyone is that new technology does not necessarily mean that it is one that is tough to use. And I think we proved that point by onboarding all our clinicians.
Okay. Now, this is driving me mad because, the name Hesyra, it kind of sounds familiar to me. I know it means something, but let me just, throw it out here. What does it mean and why did you decide to name your, innovation Hesyra?
Yes, so just now I mentioned about whereby listening is one of the most powerful tools when it comes to healing. So the HE stands for healing.
Okay.
And we want to create systems that really enable the kind of healing, that enable healthcare professionals to really have the connections and listen to their patients. Yeah.
Okay, I just Googled it. And it actually refers to, get this, an ancient Egyptian high official and physician from the 3rd dynasty known for holding the title Wer Ibi, meaning great one of the dentists or one of the ivory cutters. Well, at least it's something to do with healthcare or medical care, right?
Exactly.
Yeah.
Now, Alex, for listeners who haven't seen it, walk us through a typical consultation. How does Hesyra actually work?
Most certainly. So when a patient enters the consult room, the very first thing the clinician does is to obtain the patient's consent. The patient says yes. Thereafter, the clinician will turn on Hesyra as well as the microphone. And Hesyra really just sits in the background and listens in ambiently, taking down what was gone through in the consultation. And once the consult is done and the patient leaves, the clinician then clicks stop and generate. And here's actually where the magic happens. Hesyra then transcribes and summarizes the entire consultation in a matter of seconds. And we understand that in the Southeast Asian context, patients and clinicians, we interact with one another in a multitude of languages. And that is why Hesyra provides robust multilingual support anywhere from English, Mandarin, Bahasa Melayu, Bahasa Indonesia, Tamil, Thai, Tagalog, and most importantly, in our Singaporean context, Singlish. And we are very proud of this piece.
Wow, interesting.
And actually going downstream, clinicians can actually generate a whole suite of documents that they require. And I think what really makes Hesyra click into a very effective system is we utilize a human-in-the-loop system. And what does that mean for listeners who don't know what that is? It's basically whereby every clinician who uses Hesyra is able to edit our AI-generated summaries. And this serves as an additional layer of vetting for clinicians to approve their summary before using it in their records. And this lends to the reliability of Hesyra.
Wow, so it's real time.
It's real time.
Transcribes and structures the conversation into draft notes. So is it like ready for doctors to review, edit, and approve anytime?
So during the consultation, doctors will be hands-free. I do not have to type, I do not have to write. I'll simply talk to my patient, listen to them. Thereafter, I will be doing all these, and I can edit the summary as and when I want to.
Wow, huge time saver. Sounds like it allows doctors to be more present in the room for sure, right?
Precisely.
Now, one feature that really caught my attention is the auto-generated notes, not just summaries, but referrals and discharge letters too. Can you share what kinds of documents Hesyra can create and how reliable are they?
So these are two very important questions. And we must first note that every clinician has a unique style of note-taking as well as history-taking. And that is why we have created customizable templates, whereby clinicians are able to tailor their summaries based on their preferred level of detail. So take, for example, a surgeon. He wants something that is short, concise, to the point. Very easy. Just select brief summary and he'll get what he or she wants. Whereas on the other hand, a medical physician wants something a little bit more prose-like, a little bit more lengthy, more detailed. No worries. Just click on the detailed comprehensive summary and he or she will get exactly what they want. And it does not just stop there. It goes downstream. You need a pre-authorization letter for insurance claims. You need to write a patient letter denoting their condition in layman terms. Or you need to reply to a referring doctor. All of this can be done with the click of a button, and Hesyra will generate the relevant document for you. And I'm very happy to report that early user feedback has been largely positive.
Wow.
Clinicians state that all Hesyra documents are concise, professional, to the point, and most importantly, highly accurate.
Well, amazing. Qihuang, let me come back to you. Notes are such an important medical record. How do you ensure what's produced is safe enough to rely on?
Yes, so I think as healthcare professionals, we are all very risk averse in a sense. So I think we take safety and compliance as one of our top priority. And so I think we are thankful to have Raymond with us. So he's our tech lead, right? Right now, he's working in the financial institution as one of their tech risk specialists. So he builds the entire platform on AWS secure cloud infrastructure. It's one of the industry standard for all software development right now. And the data, the recording, the summary that's being sent are all end-to-end encrypted. So it has high data or user access control in a sense. So even I cannot access the clinic's data, right, without permission, right, in a way. So that is part of the security, and we do not store audio transcription for more than 7 days, right? And other parts to it is essentially, I think, the thing that makes or break things is the quality of the summary that's been generated, right? Is it reliable? Is it because right now you know that the AI will sometimes hallucinate, talk about things that doesn't exist? So we are cognizant of this problem, and then we have set in place safeguards and guardrails in between. So one of it is in our system, we have one AI agent that sort of like listens to the conversation and then churns out the summary. And we have a double checker. So we have a second AI that looks at the transcript and looks at the summary to see, hey, is there something that's missed out, or is there something the summary is covering by hallucinating? So that's one. And we have a pipeline also. So that is in place for us to, when we sort of like develop the prompts to prompt the AI in terms of the summary. So we have a pipeline to check for factual accuracy, to check for reliability, consistency, as well as whether it's sort of like hallucinate or basically the faithfulness of the generation. So this pipeline is generated and we have a bunch of synthetic documents or conversations to train on in that sense. And last but not least, we are post-market wise, after we roll this out, we actively collect feedback from our clinician to see whether they are they find a summary helpful, whether it's accurate.
Exactly. I think that reassurance must really matter to your early adopters. Alex, if we zoom out, Singapore's healthcare system is becoming more digital. Where do you see Hesyra fitting into that bigger picture?
Yeah, so I think essentially Hesyra serves to fulfill the lower hanging fruits. And what do I mean by this? Is Hesyra is really there to serve as a reminder to clinicians and actually the larger community that new technology do not represent new burdens, but rather new clinician-friendly and patient-friendly tools to assimilate all of us into a newfound reality, one where technology is an enabler to drive home better patient outcomes. And I think that is the essence of medicine. And at Hesyra, we aim to be this personal clinical assistant for every single clinician to be part of their everyday routines, everyday life, everyday clinical workflows. And eventually, we aim to be a platform, a playground even, for clinicians to imagine a future that they wish to see, one which we co-design together with them.
Okay, but what's next for you? Do you see Hesyra growing beyond Singapore?
Yes, definitely. So we have talked to some of our colleagues in the Indonesia, in the Philippine markets.
Wow.
I realized that this industry, or at least regionally, they are becoming more digitally literate. They are increasingly willing to adopt digital technology, but they are still lagging behind a bit. So that's why right now we are also actively finding partners within this market who can able to promote some of our solutions. And we really see these, I would say, low-income country as a way for us to really create the most impact. Because right now, their technology stack is not there. They're using a lot of pen and paper. They're spending a lot of time settling all this admin work. So that's where we see we can create the greatest impact. But in Singapore, I think we ultimately want Singapore to be a base for research and innovation. So as what I alluded to at the start, we want to be more than just taking in conversation and summarizing them. We want to be able to preempt and understand what the physician needs for a patient, for example, and then maybe draft down interventions further down the road when the patient comes in. So ultimately, what we do all these is to promote better care, unburden care for clinicians, and at the same time allowing them to connect and heal.
Wonderful, and very exciting to think of a Singapore-born innovation that could one day change clinical workflows across the world. Qihuang, Alex, thank you so much for sharing about Hesyra.
Thank you so much.
Thank you so much for having us, Lynlee.
And they are Qihuang and Alexander Shao-Rong, co-founders of Hesyra, showing how thoughtful, locally built technology can restore time, trust, and humanity to healthcare. That's all for Good Tech. I'm Lynlee. Keep it right here on Money FM 89.3.
To listen to more great interviews, download our podcasts at audio.sg or download the audio app. That's AWEDIO, audio at the App Store and Google Play.